In this video, I'm going to delve into diuretic pharmacology. Diuretics are a class of compounds that target the chemical processes that alter the characteristics of urine in the nephron, negatively shifting the homeostatically controlled electrolyte balance towards overall water loss and blood pressure reduction. In upcoming videos, I'm going to give focus to the pharmacodynamics, pharmacokinetics, and adverse drug reactions of thiazide and related diuretics, as well as looking at an example of an aldosterone receptor antagonist to wrap up the agents affecting the renin-angiotensin-aldosterone mechanism that I discussed in the last video. To start off, I want to give a brief overview of how the nephron is composed and the processes that occur to keep water and electrolytes to the levels that are required for all the different physiological events in the body. The nephron is the functional unit of the kidney and is involved in the filtering and reabsorption of small molecules such as electrolytes and glucose, and also facilitates the removal of nitrogenous wastes, as well as being involved in the active secretion and elimination of a large number of pharmacologic agents. You can therefore appreciate that if kidney function were to reduce to a level where these vital processes are unable to occur, the resultant physiological effects of what can be widespread are potentially fatal, not to mention the higher propensity of toxic drug interactions with patients on polypharmacy. So what I've done is drawn up a nephron. And first off, at the top here, we have our glomerulus, a giant capillary network where all of the blood contents are pushed out of the blood vessels and into the lumen of the nephron. And this is where our journey to the formation of urine begins. Next up, we have the main body of the nephron, composed of the proximal convoluted tubule, followed by the loop of Henle, and finishing off with the distal convoluted tubule. The last part of the nephron is the collecting duct, and this is a comparatively larger structure than the others, joining many different nephrons together, and subsequently joining with a bunch of other collecting ducts to form the ureter, a structure that takes urine out of the kidney into the bladder to be eliminated. So out of various different types of diuretics, each target a different part of the nephron, stopping a particular electrolyte transport mechanism and leading to an overall loss of water and an increase of a dilute urine production. Diuretics are named due to their mechanism for causing diuresis, which is derived from the Greek meaning to urinate, and this is why they are sometimes referred as water pills, as patients tend to describe an increased urgency to urinate when they are first prescribed a diuretic. Diuretics are used to treat a variety of cardiovascular, hepatic, and endocrine pathologies, and 6 different classes exist, each with different pharmacodynamics, which you can see here. I'm going to focus on just 2 of these in upcoming videos. I'm going to look at thiazide and related diuretics, and I'm going to look at an aldosterone inhibitor that fall within the class of potassium-sparing diuretics. Thiazide and related diuretics chiefly affect the cells in the distal convoluted tubule, blocking the mechanism where sodium and chloride ions are reabsorbed from the lumen, where the urine is, back in towards the bloodstream. Drugs of this class are used to treat hypertension, initially by causing a reduction in circulating blood volume, and then in the long term by causing a reduction in vascular peripheral resistance. Aldosterone receptor antagonists are additionally used in the treatment of hypertension, but are more better suited to the treatment of edema secondary to congestive heart failure or hepatic cirrhosis. The mode of action of these drugs are to additionally prevent sodium from being reabsorbed back into the bloodstream, but actually in a different place, this time acting on the collecting duct, blocking receptor sites for the hormone aldosterone. So that's a brief overview of the nephron, and I hope this gives you an idea of where we're going to go with the concept of diuretic pharmacology. In the next couple of videos, I'm going to explore in more detail the mechanisms of the 2 diuretic classes I mentioned before, and assess their relevance to clinical practice.